stabbing, shooting, splitting, right? These are all words that could be describing the painful headache that you just can't kick. But today we are bringing you the biggest advances to stop your chronic headache pain. Joining me is neurologist and headache expert, Dr. Audrey Halper, who knows all things about headaches. So first of all, what are the biggest triggers we ought to worry about?
Well, migraine triggers vary from person to person, but the most common migraine triggers are things like weather changes, stress, lack of sleep, sometimes different types of lighting or smells, alcohol, lack of caffeine, and sometimes even skipping meals.
So if someone's thoughtfully, and I'm sure they always are because people with migraines suffer terribly, looking at all the options, what have they already tried before they come to see you? What works at home?
Most of my patients have already tried things like hydration, different dietary changes, certainly over-the-counter medications, and many of them have even tried prescription medications that are either ineffective or may have side effects that they don't like.
Yeah, I got so many notes about this. I get it, guys. Chronic headaches are debilitating. They ruin your plans. They interfere with work. They isolate you because who wants to be around a person with a headache, right? You don't want to be around them. That's why we search far and wide for the best new advances that may stop this chronic pain once and for all. Come on over. Because first up are these cool headache wearables or neuromodulation devices. If you could explain what a headache wearable is and then walk me through a couple.
Well, headache wearables are really the newest, one of the newest migraine treatments available, and they're all called neuromodulation devices. They all provide electrical stimulation in a variety of different ways that help to interrupt the migraine pain pathways. There are 3 that are FDA approved: Cephally, Gammacore, and Nerivio, and all of those 3 actually have good clinical trials showing their efficacy with little to no side effects.
Show me just if you don't mind. So they're studying energy through your brain, changing how the blood vessels, I guess, are opening or closing, or the nerves sense the blood vessels. Is that what it's doing?
Yeah, so they change the way nerve impulses are going through your nervous system.
Got it. So one of them I noticed top in the forehead.
This is the Cephally device, and Cephally is a nerve stimulator that you place on your forehead, and it's a supraorbital nerve stimulator. So it stimulates the nerves right above your eyebrows. And when it stimulates the nerves, it interrupts the pain signals.
Okay. Next one.
This is Nerivio, and Nerivio is a little bit different. Nerivio is a nerve stimulator as well. You place it on your arm, and you control the device with your mobile device, with your cell phone, and increase the stimulation intensity. This is based on a theory called remote electrical neuromodulation, which is a theory that when you stimulate the nerves remote from where the pain is, you actually activate the brain's natural inhibitory pain mechanisms.
How did they even figure that out? This is pretty cool. And what's this last one?
And this is Gammacore. Gammacore is another type of nerve stimulator, but this one you apply to your neck. You place the gel onto the device and apply the device to your neck, and it stimulates the vagus nerve. The vagus nerve is a nerve that has a calming effect over the brain and the nervous system, and it therefore helps to abort the migraine
So
pain.
when someone sees you in your office, how do you know whether to recommend that they get one of these devices?
Well, there are a variety of different features to the devices and different features to the patient's pain that may direct you to one or the other. Some of them, such as the Cephally, can be used for migraine prevention as well as for acute migraine relief. So in someone who needs prevention, we may use that. The Nerivio device is kind of easy to hide under your sleeve. Yeah. You may not want to walk around with...
Like a unicorn. That's right.
Exactly.
I'll tell you, if it gets rid of the pain, I think people would do just about everything.
Yeah, and all of these are very effective, especially when being used early in the migraine attack.
So I asked Jamie to join us. Come on in, Jamie. She's been wearing a wearable, one of these neuromodulation devices as prescribed by her doctor. I just can't understand. I want to know how well it worked. Was it a 5% change, a 50% change? Did it alter everything about how your migraines are hurting you?
So I actually woke up with a migraine today. Oftentimes you'll have like cluster migraines. And so I put on my Nerivio on my arm, and I can do that and still kind of get the kids ready for school. And then you use your app. It's 45 minutes, and you increase the intensity as you need to. And then my migraine was gone. So thankfully, so I could be here.
Yeah, is that pretty typical that the migraine? I didn't know it would go away.
Yeah, all 3 of the devices have good efficacy at actually aborting a migraine and keeping it away.
Well, I'm so happy you wouldn't have been here. You're right. I would have missed out on all this insight. Thank you very much.
Thank you.
All right, next up, there are these ear piercing approaches that some say could help with migraines. They're called Piercing. It's done on the innermost cartilage of the ear. You can see the picture there. So how can a date piercing potentially help someone with migraines?
Well, date piercings have actually become more popular over the last few years. There are anecdotal reports and anecdotal evidence that it may help reduce migraines, although there's no good controlled trials showing this. We think that maybe that you, again, may get activation of the vagus nerve, which may help to reduce the migraines, and that may be how it's working.
Yeah, who knows? But there are energy meridians going through your ear. There's lots of things we don't even understand in Western medicine. But again, the key thing is, does it work or not? We don't know for sure, but some people might be interested. So Lori's one of my viewers. She sort of likes piercings anyway. She's okay with it. And she's agreed to get a date piercing today to see if it would help you. Is that true?
That's true. I'm hoping it'll help with my frequent migraines.
All right, well, we just saw one individual who was helped by a device, and then we can see if this is an alternative. This may actually be a stylistic alternative. I've got Dana here from Lark Tattoo, Westbury, New York. Thank you for being here.
How are you? Thank you.
Have you been doing many of these?
No, she's my first.
First ever? Are people actually coming to your clinic ask for migraines?
So they come in, the appointment is made, and I basically ask them if it's for aesthetics or if it's for migraine purposes. I get both as an answer. I get, migraines as an answer, but we're not an acupuncturist, we're not a doctor, but we do know where we're hitting, and hopefully we can help her alleviate some of that.
So I've got my famed lipstick cam. May I pull your hair back? Is that okay?
Go ahead.
I have a bobby pin here too.
I'll hold it. It's okay. My steady surgical hands.
Great.
What pretty ears you have. So go ahead and show us how it's going to.
So first we're going to just clean the area in here. I will be clamping the area. First I'm going to stick my fingers in here and just kind of feel around there's this little buoyant little area inside there that you want to try to really go for and hit with that needle here. So we take the needle. This is a brand new petroleum, by the way.
So walk us through. So the needle's in your hand.
The needle's in my hand now. I'm just prepping the needle now. So I'm going to prep the needle. I'm going to wipe the area clean.
I bet you never had your ear clean like this before.
Certainly not on camera.
Well, you mark your spot.
A little bit, yeah.
This is very surgical of you. Yep.
Yeah.
Yep. That's exactly what we do in the OR, by the way. We mark what we're about to do. That way, because we only do it once, right?
Yeah, we'd like that.
Okay. All right, there you are.
So now here we have the clamp, and the clamp is the most.
Should I hold your hands?
I might elbow you, though.
Oh, not your hands.
No, I'm okay.
Dana, you're on your own, Dana.
I'm all right.
You okay?
Yeah.
So yeah, the most invasive part's usually the clamp here. Good, and I'm just gonna come underneath you here. Good, and we're inserting. Nice job. Good.
Oh my goodness.
Good. I'll just ask you to be nice and still in this part here. Okay, love.
Ooh.
There we go.
Oh my goodness. Look at that.
And we're just gonna close up the earring.
How'd you do that?
So the earring is titanium. It's a non-porous metal. We like to use a non-porous metal for all, if not most piercings, because there's no nickel trace in the titanium. It's implant grade. So here we're just gonna close it. Sorry, just need elbow room.
Okay.
Perfect.
Woo.
I know, Mama. You're a trooper. And then we just clean the area.
Okay.
I gotta say, that looks pretty cool.
Thank you.
There you go. And then you can get pretty stuff with flowers and anything intricate like that. There's some ornate pieces, but this is really more for the migraine purpose than aesthetics.
Nicely done.
Thank you.
I hope you're happy with you.
Shaky hands today, guys. Sorry.
Doing it on national television, doing anything on national TV.
I'm usually a little private area, and you're so nervous.
If you're interested,
Dr. Oz, someone.
if you're interested in getting a date piercing, you should go to a licensed piercer like Dana here.
Yes, I am
who can
licensed.
figure it out. Up next,
20 years.
we tried new under $50 headache solutions that you could buy online. So stay tuned to find out which ones worked.
Thank you
I
so
am
much.
really intrigued by this.
Yeah, it's cool.
It looks good.
Yeah. Thank you, Dana.
Thank you for letting me. The worst thing in the world.
A bad headache can make us desperate for easy, cheap solutions, and Amazon has exploded with new at-home devices you can get delivered at the simple press of a button. But which of them actually works? We're putting them to the test today. Dr. Halpern is back giving us the science behind the items as we go along, and Liz is a viewer whose chronic headaches prompted her to write into our show. She agreed to be our official tester, our headache tester. Thanks for doing that. Describe your headaches a little bit.
I can get just a regular headache or a migraine, and they're debilitating.
Are you difficult to be around with a headache?
Yeah. I don't talk much, and I'm just...
No one can see it, so it just makes you miserable by yourself, which is the worst
Actually,
part.
they can see it.
Oh, they can?
Yeah, they can see it in my eyes.
Yeah. Well, you have expressive eyes. I could believe that. All right, the first headache device, come on over, is a Migraine Relief hat, which I'd never heard of before today. Dr. Halpern, how does this work? And Liz, if you don't mind, have a seat and show us how this goes on your head, just so I can appreciate it. Liz, go ahead, put that on. I want to see what it looks like. It's a nice color, by the way.
Yes.
Oh, my goodness. Oh, it really fills your... It closes your eyes over.
Yes.
So how does this work?
So this is put in the freezer, and this is a cold pack, essentially, that covers your entire head. And the cold actually provides a local anesthetic effect, if you will. It numbs the pain. There may be other effects as well. Cold constricts blood vessels, and there may be some pain relief you get from that as well.
Liz, you can take that off. I hate to... You look like a bird that's been... blinders put on. Has it worked for you, this thing?
Yes, it was great. It helped my head. Like, it just felt better, that it was cooling, and it was just really great.
But you have to leave it on for quite a few hours, right?
No. Like, I would take medicine and just put it on, and it would be really
How long would you leave it on?
as long as I needed to, like, until the headache went away.
So half an hour, 45 minutes?
Yeah, about a half an hour.
Oh, that's not bad. It's topical. It's
bad.
pretty straightforward. You're not putting a pill in your body.
That's right. And some people actually will have a second one that they can keep cold in the freezer, so if they need more extended.
Because I was reading about them, and I saw you could keep them on for hours if you wanted, but I guess you keep flipping out the ones you're using.
That's
like
right.
if you sprayed your ankle.
That's right, exactly.
Okay, don't use it for that, though. All right, there's a ton of different kinds of headache hats like this. You can get them for around $30. Next up are these headache patches. Come on over, let's talk about these. Now, again, these patches can be, I guess they can have aromas on them as well.
That's right. They can contain a variety of different ingredients. You want to make sure that you put it on a part of your skin that doesn't have hair, and of course, make sure that you haven't applied any lotions or oils before.
Oh, you don't put them on your head?
No, you can put them in a variety of locations, but make sure it's not somewhere where your hair is.
Yeah, that's where your head is where the hair is.
Yeah, well, it won't absorb into the
I get it.
your skin.
All right, so Christina recorded her experience trying this during her last headache. Check it out.
Whenever I feel a headache coming on, I simply grab a patch, which is so simple. You grab it and you take off the film, which is a nice plastic covering, and you place it on your forehead like this. It sticks, and ooh, an instant feeling of cooling comfort.
So why do you think that worked for Christina?
Well, the patch that this patient used, had a combination of butterbur, ashwagandha root, and ginger, and all three of those substances have been shown to reduce inflammation. Inflammation is a really important part of the pathophysiology of migraine, and so reducing inflammation is really important. There's also actually a very good double-blind placebo-controlled trial looking at ginger for acute migraine relief, and it is effective.
You're kidding me. This old treatment for all of these generations, moms have been talking about them.
That's
and
right.
They did a high-quality medical trial and showed that it benefited?
That's right.
Well, why do you give ginger to all your patients now?
I give ginger to some of the patients. It's something that not all patients are interested in using, and certainly more and more patients are becoming more interested in non-pharmacologic approaches, which includes natural remedies.
So you can put ginger in your food, or you eat it, or you put it as a patch? All of them?
Yeah, or there's a sublingual ginger.
My
that's
goodness, it's
effective.
fantastic. Next is the acupressure hand device for tension headaches. So what's the science behind this one?
So you would take this device and you place it in between the thumb and the first finger, and you allow it to apply pressure. This is a very common acupressure point. Again, that's been used for a long time for acute migraine relief, and it's based on traditional Chinese medicine, acupuncture, and acupressure.
You know, I just wrote a book on traditional Chinese medicine, Yin Yang Yu. Pardon the play on words, but I learned that these acupuncture points are used widely, and they turn into acupressure points.
That's right.
That's why even things like piercings, you should double check to make sure it's not going to turn on some acupuncture point you don't want.
That you don't want to turn on. That's right.
Just in case,
That's right.
don't cause headaches. Do no harm. All right. Listen, this
Exactly.
may alleviate the tension as well that you have in your body, which may help you with your headache. It's retailing right now at Amazon for under $20. Thank you very much, Dr. Halpern.
Thank you.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.